In Topeka, some of our state's largest hospitals have reached capacity, but it's not just bigger cities that are running out of healthcare resources. KSNT News reporter Noah Ochsner hit the road to find out what major impact the pandemic is having on our rural communities.
Just 15 miles from the Colorado border is Tribune, the county seat of Kansas's least populated county. And in Tribune sits an example of rural healthcare, Greeley County Hospital, now faced with the reality of COVID-19 and the changes the virus brings to rural healthcare.
Kind of changed our delivery model altogether. Everything's focused on COVID and COVID response, essentially. However, we've had to do some increase in telemed and home visits. Actually, rural healthcare out here allows us to do some home visits with our doctors.
The delivery model might be changing, but also changing is the hospital's ability to transfer patients.
So if the ICUs are already full, I think we're definitely susceptible to that risk of not having a place to go, not only with our COVID patients, but stroke, heart attack, all of those conditions as well.
So here's the reality for towns like Tribune. The nearest ICUs are in Garden City and Hayes, both well over an hour away. If both of those hospitals are full, then it's up to cities like Denver, which is over 3 hours away. If Denver is full, then Wichita, 5 hours. And then Kansas City, over 6 hours away. Worst case scenario, you have a stroke or another major medical emergency, and there's nowhere for you to go. But even before COVID-19, small hospitals face challenges, and the pandemic has only brought more focus to the challenges rural healthcare faces.
We're very susceptible to staff shortages, so in relation to our backup stock of staff to fill those positions in the event that our staff is out on quarantine or exposure, we're very susceptible to crisis staffing levels in that event.
No matter how big or how small of a community, COVID-19 is leaving a far-reaching impact on healthcare in Kansas. In Tribune, Noah Ochsner, KSNT News.
Watts also says you should not delay urgent or routine care if you need it. So if you need to visit the ER, you should do so, and do not skip regular checkups as well.